Parents, did you know that 30 to 80% of children diagnosed with autism also meet criteria for ADHD? And also, did you know that 20 to 50% of children with ADHD also meet criteria for autism? And that's what we want to talk about today. The overlap between diagnosing of both ADHD and autism in a child and what that looks like and the approach for treatment for that. I think this is a really important topic because this is a question that comes up on a weekly basis in our practice, and I thought it would be great to address it. Hello, everyone. I'm Dr. Hoke Echo, and welcome to Glow with ADHD and Autism. And so we're going to just take a deep dive into it right now, okay? So let's talk about Ethan. Ethan is a child we recently worked with, of course, name changed for privacy's sake, and he was diagnosed at age 5 with ADHD and prescribed medication, right? However, his family noticed he still had major meltdowns with sensory triggers and struggled socially. Eventually, right after the parents had pleaded with the school and kept talking to this pediatrician saying something is not quite right. Like, isn't there more to this? Because in spite of the medication, he still seemed to be really struggling. Eventually, parents were able to get another evaluation, which showed he met criteria for autism. That changed everything about his treatment plan. The prescription for medications alone did not address the sensory issues he was having, the social struggles, the meltdowns when things didn't go his way or did he was told no. So it's important to address the whole child, and that's what we do at Glow Pediatrics is whole child approach, whole family approach. So when your child has both ADHD and autism, it's essential to address both sets of needs, right? For example, a stimulant for ADHD might help with attention, but worsen anxiety, which is another comorbid diagnosis that often highly occurs with children with either autism or ADHD, and sensory overload, right? So the stimulant can worsen the anxiety, can worsen the sensory overload, and that will not help your child. And so that's why it's important to focus on a holistic approach to treating your child. And so at Glow Pediatrics, what we do is we create a personalized nutrition plan, behavior plan, and what that nutrition plan is really targeting is targeting gut health, because absolutely critical that we address gut health because the gut is directly connected to the brain. If your child's brain has any inflammation or dysregulation going on, things don't work well. Sleep is huge. Think about it, parents. If you don't sleep and your child is not sleeping all night, or your child sleeps for a couple of hours a night, we cannot expect that child's brain to work like it should. We take deep dives into nutrition, sleep, gut health, brain health, emotional resilience, parent support. It's important to do that because that's a holistic approach, right? Versus just handing you medication. Yes, medication can work, but it's not addressing the root causes, which is what we want to do so that overall your child's health improves and your entire family does well. What can parents watch for? How do you know if your child has both? That's an excellent question. So here are a few signs, right? With ADHD meds, your child may focus better, but still have meltdowns. That's a clue. Something else is going on. Your child can have both social communication struggles and executive function issues. The part of the brain that's affected in both autism and ADHD is the frontal lobe, and that's the part of the brain that deals with executive functioning, so like making decisions, not being impulsive, following through on plans, communication, executing projects. Those critical skills that are important to everyday function is controlled by here, and that's the parts of the brain also that's involved with both ADHD and autism. It's important to recognize your child can struggle with both things, right? And that sensory, and then you see your child has sensory issues like they may not want certain materials to touch their skin. They may not want their certain foods mixing together on the plate. They may be affected by loud sounds and cover their ears or run away. Sensory things like they just have they're very specific and like they have to have a certain routine. If anything changes, then it's like they have a meltdown and they can't handle moving forward from that. These occurrences can be very frustrating for both the child and the parent. If you see that happening alongside hyperactivity, that gives you a clue that maybe there's something else going on with your child. And if that sounds like your child, you're not alone. We are here to help at Glow Pediatrics. We understand that parenthood is a journey. I'm a mommy of three. It's definitely a journey. As a pediatrician, I'm still learning every day because every child is different. How do we help our children who may have both things going on? As parents, we're our children's first advocates. You know your kids more than anybody else, parents. So please advocate for your children. And if your doctor says no, go find another one and keep asking till you find help and somebody listens and gets you the help. Talk to your teachers, get to know your teachers so that they can give you a clue into, are they seeing the same things that you're seeing at home, at school? That really helps, especially if we can see the behavior happening in both places, right? But again, at Glow Pediatrics, we're here to walk alongside your family on this journey called parenthood. And if you have any concerns, we offer telemedicine evaluation, medical evaluation for autism and ADHD in several states across the country. We offer parent coaching, parent-led ABA therapy. We offer personalized nutrition plans to address gut health, address brain health, address sleep, constipation, picky eating, aggressive behavior, because we know for a fact that our children, if we don't look at them from a whole perspective, holistically, we don't make as much impact as we could. So at Glow Pediatrics, our process is to look at the whole child and all the environment that the child is in and see what changes can be made so that this child can be the best version of themselves. And guess what we found? That as we work with the children, we're impacted. It's the parents, the whole family. So when we do personalized plans for our children, we want the entire family to participate because it makes such a difference. Parents, if you're not sure, if you feel like there's something more going on in your child, you are not crazy. Ask for help, reach out to us, book a consult, call on glowpediatrics.com. Please subscribe to our channel, share it with those who need to hear this message, and we look forward to serving you. Have a wonderful day. Remember, your child is more than a diagnosis. Your child is valuable. Your child wants to be seen and heard by you. You're the best parent for your child. And never ever forget that we want to be detectives of our children and we want to find what their strengths are and boost those, right? Because that's how you look beyond a diagnosis and look at the potential for your child. So have an amazing day and look forward to serving you. Take care.